Hi, my name's Louise Freebairn. I'm one of the team working on the Right Care First Time Where You Live program of research. I'm going to be talking on this video about the participatory modelling process and the workshops that we use to develop systems models for youth mental health systems. But first, I just wanted to acknowledge the traditional owners of the land from which I'm speaking today. For me, that's the Ngunnawal people. I want to pay my respects to their elders, past, present, and emerging, and just to recognise and pay tribute to the valuable contribution that the Ngunnawal people and other Aboriginal and Torres Strait Islander people make to the community where I live and work. I also want to acknowledge the valuable contribution made by people with lived or living experience of mental health issues and substance use issues, and their families and carers, and really recognise their courage and bravery in contributing to our research and helping us to learn and grow and as we aim to improve outcomes for other people with the same experiences. So I'll be talking about the participatory process in our workshops. So there's lots of moving parts that impact on mental health systems. There's changing population and demographic dynamics. There's a broad range of determinants and influencing factors. There's changing behaviour. People's behaviour changes over time. Their needs change over time. And there's also changes in how services respond to fluctuations and changes in service demand. And that's not just the mental health and health service system. It also includes the education services, housing services, community services, social services. So this is really complex. It's a really complex system, and it gives rise to uncertainty about how best to intervene, how interventions and service improvements might play out within this complex environment. So system modelling can help us to better understand this complexity and to guide and inform decisions about ways that we can move forward in the future to improve things. So we build systems models with stakeholders using the process that's visualised in this diagram. So participants with an important stake in the topic are identified and invited to participate in model development workshops and as a group. And we combine their expert knowledge, their lived experience and their local practice knowledge with various forms of evidence to collaboratively define the scope and build a conceptual map of the focus issue. And in this case, it's youth mental health. This conceptual map is quantified using system modelling methods, and the model is refined and validated in collaboration with the stakeholders who are involved in the participatory process. We develop a user interface that allows end users to run their own what-if questions and scenarios and explore the impact of interventions both independently but also in combination. So looking at a suite of interventions and exploring their impact on their local service system. The key message from this slide is that end user participants are central to this process. They're right in the middle with consulting all the way along, and they're really important to ensure that we have a useful model. So the iterative process centres around 3 workshops where participants interact and actively engage in group activities to develop conceptual maps of the factors that contribute to youth mental health issues and their potential outcomes. The model development process involves co-production at every stage, with the modelling team working really closely with the site, deciding which data is most appropriate to use, checking in on key questions that arise and receiving feedback on the model as it's being developed. And we use participatory action research methods that are flexible, and they allow us to modify our activities and processes as needed to optimise engagement at each site. We understand that each site will have different requirements, and we'll be working closely with each of our partners and our other advisors to accommodate those as much as we can. So just focusing in on workshop 1. This is our introduction to system modelling. So just want to flag that we don't assume that any participants come to this process with knowledge or experience in system modelling. The modelling team will provide an introduction to the purpose of the modelling, key concepts and terms, introduction to the main components of the model structure, and just bring people along on a journey to learn about system modelling and how it can be used. A second main purpose of the workshop one is to provide an overview of youth mental health for that region. And this is actually most effectively done when it's provided by a local expert who we really encourage people from our partner sites to co-facilitate the workshops with us and lead some of the discussion. And this is where that part can start. So it's really great to have a local person providing the overview of that youth mental health system. And this provides an overview of the epidemiology of youth mental health and the current challenges for the local community. The third dot point there is a collaborative system mapping. This is our major activity, interactive activity for workshop one. And you can see an example there in the picture that's on this slide. This is where we collaboratively make a conceptual map of the youth mental health system for the region in which we're working. And, you know, system models are pretty sophisticated computer science methods, but the process that we use to get to that end point of having a sophisticated system model is a very practical process. So it's very tactile, it uses paper, post-it notes and texters and tape and people working and talking together to actually draw out what's driving the system, what does the system look like, where are the challenges, where are the bottlenecks in the system, and then that is then converted into that computer model. At this workshop, it's really important to understand what hooks we need to include in the model, just to make sure that we have the right places in the model to capture the impact of interventions, and that we're tracking the right outcomes that are of interest to the local site. So we go through a process of prioritising interventions and outcomes that will be explored. And we also provide an introduction to the economic approach, and Kenny Lawson will be talking about that in detail in a separate video. So workshop two, which is a second full day workshop. It happens about 2 to 3 months after workshop one. And workshop two is really focusing on defining, refining and mapping interventions. So the first main purpose for workshop two is to feedback and refine. So the modelling team will present back the model conceptualisation that was developed from workshop one and walk participants through the model structure and logic and show how that fits back. And it's also an opportunity to actually, for a group discussion around any unresolved questions and where we haven't been able to identify evidence to inform the model. And what we know is that the participant group actually brings together decades of expertise, and participants know the relevant data for their local area. They know the best evidence, they know the limitations of the available evidence, and they know where there's knowledge gaps. So we're really trying to tap into that expertise to help us build the best model that we can. And the practical activity at workshop two is defining and mapping the interventions. So we really want to do a deep dive into each of the interventions that will be implemented in the model. And depending on time and scope, we usually prioritise 6 to 8 interventions to be implemented. And we get participants to work together to describe the either existing interventions or define hypothetical interventions that they want to explore in the model, and to help us identify an evidence base to quantify the effects. And workshop 3, so this is generally a half-day workshop where we walk through any changes to the model just as an opportunity to verify and discuss those changes. We present the user interface and demonstrate how it can be used to run what-if scenarios and have discussion about the outcomes from those scenarios. We generally have a whole lot of computers set up at the workshop with the interface running so that people can actually sit at a computer and have a go at implementing the interventions. And we just like to make sure that people understand what's possible in the interface and how they can interpret results. We have some discussion about the initial insights that we've observed from the what if questions that have been prioritised and explored in the model, and just get some feedback about how we're presenting the results and whether that's a useful way for people to receive that information. So these results that I've got on this slide were from some interviews that we did in previous research with end user decision makers who'd been engaged with previous participatory modelling processes. And these are senior clinicians, senior policymakers from jurisdictional health agencies who had worked with us on previous research. And what they identified as being the benefits of participatory modelling. And they found that the participatory process increased their familiarity and trust in the model. People understood the model much more than models that had been developed without that sort of stakeholder engagement and participatory process. They liked that the models could synthesize diverse evidence. They could be used to explore the impact of interventions in combination and the interaction between interventions, and that you could explore the impact of new or untested hypothetical interventions before they're implemented. One of the other advantages was that the modelling can be used to sort of forecast delays in intervention effects, which can be used to sort of help with expectation management when an intervention is being rolled out, and they can also help us to identify and prioritise evidence gaps. And on this slide, there's just some quotes from some of the participants, just things that people made. I think sometimes the participatory activities can be a little uncomfortable for some people, and that's reflected in the first quote saying, really, we know all this stuff, and do we have to spend all this time? But you realise that that's the nature of it. If we didn't go through these processes, there wouldn't be the same trustworthiness. People wouldn't trust it as much. They'd be questioning it. The session with lots of string and sticky notes and things on the board, it looked like a mess, and I went away thinking, how are they going to use all that? But I was actually surprised that it was actually used to inform the development of the model. And the participatory approach, you have people in the room that have accumulated knowledge and expertise in an area over quite a number of years, and brings a lot of knowledge into that room. And it's not possible for 1 or 3 or 5 people to do all of the literature searches and understand that information. So by bringing together the whole group of participants, we really do bring a great deal of expertise into that room and into that model development. So sustainability, we really want to facilitate sustainability. We want this project to live beyond the site implementation, and there's a whole range of strategies that we have in place that we hope will facilitate this. I'm just going to talk about a couple of them in the last couple of slides. So post-workshop support, we want the models to be useful, and we think that the participatory process can help us to build useful models that are applicable and relevant to the sites that we're working with. But we also want the models to be used. So we'll be implementing super user training, so nominated people from the primary partner agencies, so it might be the PHNs, or other participants from each site will be offered super user training in the use of the model to build competency in being able to use it to explore policy scenarios and interpret and report model findings for their policy briefs, other reports, business cases, or for advocacy. And so by doing this, we hope to ensure the sustainability by embedding the model into some local decision making. With the super user training, we provide a step-by-step training process in how to run scenarios, how to modify parameters and assumptions in the model, how to interpret the graphics to find the insights, and how to export the data for further analysis if it's required. It also includes, so the super user training will include analysing the economic outputs and generating evidence for business cases. So one of the other strategies that we have for sustainability is to offer the Brain and Mind Centre Youth Model training package. This is an interactive half-day workshop which can be done face-to-face or online. The training is delivered by a clinician researcher and a lived experience researcher from BMC, and it has CPD accreditation for many professional groups, as you can see on the slide. The model training covers personalised assessments and measurement-based care models to help manage youth mental health. covers illness trajectories for young people, assessment frameworks, covers how the youth model can be used to personalise care options and service delivery, and digital technology options to enhance clinical care. And in terms of digital technology, the program also offers a 1-year free license to use the Inaugural platform with implementation support provided by a BMC implementation officer. So this technology enables highly personalised, multidisciplinary and measurement-based care for young people regardless of where they live, and is a great resource for services. So that's all I'm going to cover in my video today. If you have any questions or want any more information, connect with us. There's an email address here on this slide, or some of our social media tags are here as well. But we look forward to working with you as we roll out implementation over the next couple of years. Thank you.